Hi and welcome back to the channel. Today we're going to be looking at Lactational Amenorrhea Method, LAM. So Lactational Amenorrhea Method is an efficient way of preventing pregnancy in women who have just given birth through frequent breastfeeding. We're going to be using the outline, introduction slash definition, mechanism of lactational amenorrhea, criteria for lactational amenorrhea, effectiveness of lactational amenorrhea, advantages slash disadvantages, and summary. The lactational amenorrhea method can be a highly efficient method for breastfeeding women to use physiology to space births. This contraceptive effect has been quantified since the early 1970s. Breastfeeding delays the resumption of fertility after childbirth. The length of the delay is related to the frequency and duration of breastfeeding episodes. So the lactational amenorrhea method is highly efficient and women use this physiologically to space births. This contraceptive method has been quantified and proven to be effective since 1970 that breastfeeding would delay fertility and childbirth. The length of the delay, however, is related to how frequent and how long breastfeeding episodes last. So, the lactational amenorrhea can be defined as the natural contraceptive effect of exclusive breastfeeding leading to elevated prolactin levels and associated amenorrhea with anovulation is known as the lactational amenorrhea method. So, this method involves giving breast milk exclusively, that's only breast milk, for at least 6 months, which will result into elevated levels of prolactin, and prolactin delays ovulation and also delays menstrual bleeding. So this combined will result into delayed pregnancy after childbirth for at least those 6 months. So the exact mechanism of lactational amenorrhea is poorly understood, but the most plausible hypothesis is that suckling results in a reduction in the release of gonadotropin releasing hormone, luteinizing hormone, and follicle stimulating hormone. Endorphins induced by suckling also induce a decline in the secretion of dopamine, which normally suppresses the release of prolactin. Because prolactin inhibits gonadotropin pulsatility, nursing women typically remain amenorrheic for a variable length of time after giving birth. Higher frequency and longer duration of nursing contributes to menstrual suppression. Night nursing is highly correlated with anovulation and amenorrhea. So, in a nutshell, suckling causes the depression of gonadotropin releasing hormone, luteinizing hormone, and follicle stimulating hormone, which are essential for a woman to ovulate and experience menstrual bleeding. Also, endorphins, which are induced by suckling, also help decline dopamine, and dopamine depresses the release of prolactin. Now, when these endorphins are induced and help the decrease of secretion of dopamine, prolactin is released uninterrupted. Now, prolactin, on the other hand, will help depress or suppress ovulation as well as menstrual bleeding, resulting into what? Suppression of pregnancy for at least those 6 months lactational amenorrhea has been practiced, or those 6 month exclusive breastfeeding is performed. So what's the criteria for lactational amenorrhea? The criteria for successful use of lactational amenorrhea is continuous amenorrhea. So the woman makes sure that she breastfeeds frequently and for long to maintain the absence of menstrual bleeding, exclusive breastfeeding with no supplement. So the woman should give only breast milk for at least 6 months to the baby without giving any other form of feeding. So this is done for up to 6 months after delivery. Night nursing is highly protective. So breastfeeding of the baby at night is also highly protective and effective when done. So during the first 6 months, if breastfeeding is exclusive, menses are mostly anovulatory and fertility remains low. So if exclusive breastfeeding is practiced during the first 6 months, even if menses occur, they do not occur with ovulation. Ovulation do not partake in it, and fertility will relatively remain very low. So when using lactation as a method of birth control, the mother must provide breastfeeding as the only form of infant nutrition. Supplemental feeding may alter both the pattern of lactation and the intensity of infant suckling, which secondarily may affect suppression of ovulation. So if the woman doesn't use only breastfeeding as a form of feeding the baby, the other feeding may interrupt how good the baby sucks or how frequent the baby sucks. Those will result into failure of an ovulation to occur because the pattern will be distorted. Second, amenorrhea must be maintained, so the woman should ensure that breastfeeding and breastfeeding is done effectively to prevent menstrual bleeding. Finally, the method should be practiced as the only form of birth control for a maximum of 6 months after birth. If another pregnancy is undesired, most practitioners advise lactating women to use a reliable contraceptive method starting 3 months after delivery. A recent World Health Organization study on lactational amenorrhea revealed that during the first 6 months of nursing, cumulative pregnancy rates range from 0.9 to 1.2%. However, at 12 months, pregnancy rates rose as high as 7.4%. When used correctly, the failure rate in the first 6 months postpartum is less than 2% generally. So in lactational amenorrhea, the effectiveness reduces as the day progresses. So it's gonna be more effective in the first 3 months, less in the first 6 months, and lesser in the first 9 months. So when it is done correctly, the failure rate though in the first 6 months is less than 2% after birth. But you should note that the longer you use it, the less effective it becomes. So effective use of lactational amenorrhea improves with education regarding the efficacy of the method. So when women are well educated on how to do it, it becomes more effective because most women try to do it but they do it wrongly. It's either they do not breastfeed for long or the frequency is too low. Because breastfeeding may end sooner than anticipated, a provider should discuss in advance a reliable ongoing contraceptive plan for prompt initiation if conditions required for success with lactational amenorrhea are no longer in place. So for one reason or the other, the mother may not be able to continue with breastfeeding. So the health practitioner who is educating the mother on how to use this method effectively should also plan of another form of contraception in case things don't go as planned in order to prevent pregnancy. If the mother is exclusively breastfeeding, is less than 6 months postpartum, and has no menses, that is, no bleeding perceived by the mother as menses that occur after 56 days postpartum, or any consecutive 2 days of bleeding, the unintended pregnancy rate is 0.5 to 2 per 100 women years. If these conditions are not met, an additional contraceptive is needed. So if the mother is exclusively breastfeeding less than 6 months after delivery and has no period, that's no bleeding perceived by the mother as bleeding during menstrual cycle after 56 days after delivery, or any consecutive 2 days of bleeding, the unintended pregnancy rate is 0.5 to 2% in women at least for a year. If these conditions are not met, then an additional contraceptive method should be added to prevent pregnancy. So what are the advantages of lactational amenorrhea? Lactational amenorrhea is a simple method of contraception. It is cheap, it is easier to practice, it is easily available, it is patient controlled, it can be successfully practiced by all social classes. It is natural, hence no or minimal side effects. Lactational amenorrhea is as effective as the mini pill. It is effective as progesterone-only hormonal contraceptive pill. It prevents unintended pregnancy in about 98 to 99.5% if correctly used. It requires no special technical know-how. So what are the disadvantages of lactational amenorrhea? Higher frequency and longer duration of nursing may be discomforting. It is not a long-term form of contraceptive. Breastfeeding will only prevent ovulation in the woman who is fully or nearly fully breastfeeding and there is continued amenorrhea. Pumping, that's the use of breast pump, does not have the same effect as suckling. It is not a reliable method when menses resume earlier than anticipated. It is not effective method of contraception after the first 6 months postpartum as failure rate is high, 7.4% up to 12 months. Lactational amenorrhea cannot be practiced effectively with supplementary feeding. In summary, the contraceptive effect of lactational amenorrhea is based on the concept that the intensity and frequency of suckling in breastfeeding is associated with elevated prolactin levels, amenorrhea, and anovulation. This method is excellent for up to 6 months as long as menses has not resumed and there is exclusive of or near exclusive breastfeeding, that's at least 85%. Regardless, if the mother is exclusively breastfeeding or not, it is prudent to counsel the mother on additional methods of contraception to prevent pregnancy. Thanks for listening. Have a wonderful day.